Welcome to the Hawaii Health Data Warehouse's Coffee Break monthly webinar series. I'm Julia Chosey, a public health epidemiologist with the Hawaii Health Data Warehouse, or HHDW. Today, we're very excited to showcase our newest data tracker, the Diabetes Plan 2030 tracker, in hawaiihealthmatters.org. I'll give some background and information about the tracker, and then we'll hop on the website and do a live demo. So the tracker is the result of a collaboration between the Hawaii State Department of Health, Chronic Disease Prevention and Health Promotion Division, and the Hawaii Health Data Warehouse with the University of Hawaii, Thompson School of Social Work and Public Health, Department of Public Health Sciences. So this tracker supports the Hawaii Diabetes Plan 2030. So this plan, Hawaii Diabetes Plan 2030, represents a coordinated effort between stakeholders and partners throughout the state who work together to develop objectives and strategies that utilize data, best practices, and evidence-based science. The resulting plan reflects a common vision for preventing and managing diabetes to help the people of Hawaii, especially those at risk, lead healthy lives. The Diabetes Plan 2030 is also part of a larger framework called the Healthy Hawaii Strategic Plan. So the Healthy Hawaii Strategic Plan, or HHSP, is a roadmap for preventing and reducing chronic disease in the state of Hawaii through 2030. It brought together a large and diverse group of stakeholders who contributed their expertise to 6 different health areas: asthma, cancer, diabetes, heart disease and stroke, physical activity and nutrition, and tobacco. The HHSP guides work on health priorities to create sustainable changes where people live, learn, work, and play so that healthy options become the easiest choice. If you're interested in seeing the full plan or the executive summary, go to hhsp.hawaii.gov. Of the 6 topic areas in the Healthy Hawaii Strategic Plan, Hawaii Health Matters has trackers for 4: cancer, diabetes, physical activity and nutrition, and tobacco. And in the future, additional trackers may be created. Let's talk about the Diabetes Plan Tracker. So it can be found in hawaiihealthmatters.org along with our other data trackers. It's a curated dashboard of 48 different health measures related to diabetes. I'll be transparent and let you know that currently there are 42 indicators, but those last 6 latecomers will be added very soon. Many of the indicators have target values for the state to work towards by 2030, and the tracker, so it provides a quick and easy way to check our progress towards those targets. To help users navigate the tracker, the indicators are divided into 7 different topic areas or sections. So these include prevalence, diabetes-related outcomes, management, comorbidities, risk factors, youth risk factors, and social drivers of health. The next few slides will show you all of the indicators for each section. So I'm not going to go through them all, but I wanted to give you an idea of the kinds of measures that are available in the tracker. So here you can see the variety of indicators around prevalence and diabetes-related outcomes. These are the measures that we have around management and comorbidity. And we have 2 risk factor sections, one for adults and one for youth. This provides valuable information about who is at risk and how those risk factors are changing over time. And then last, there's a section on social drivers of health. This is important because we know that different social and economic factors can influence health outcomes. So this section is showing how these factors are affecting adults with diabetes. The Diabetes Plan Tracker pulls data from many different data sources, and this allows the tracker to cover a wide variety of measures related to diabetes. Here are just some of the data sources that are represented in the tracker. We created 22 new indicators for the tracker, and these include measures around diagnosis and testing, comorbidities, healthcare access, and those social drivers of health. So that includes things like food insecurity and bills, as well as access to transportation and social and emotional support. I want to be sure you all know where to find this tracker. If you go to the Hawaii Health Matters homepage, you'll see an option for data trackers in the navigation menu. And if you hover over it, a drop-down menu appears showing all the data trackers. You can find the Diabetes Plan 2030 tracker on the right side of the drop-down with the other Healthy Hawaii Strategic Plan trackers. Alternatively, if you click on that data trackers in the navigation bar, you'll be taken to a page that shows you all of the trackers, and the 4 HHSP trackers are located towards the bottom of that page. Before we go to the demo, I just want to cover some basics for Hawaii Health Matters for people who maybe aren't familiar with the site. So HHM is a great site for people who want more than just data. So it provides a lot of comparison data and links to resources that help put the data in context. So the site uses comparison data and icons that incorporate colors and symbols to help users interpret the point estimate. In general, red is bad, green is good, and blue is neutral. And when you see a solid box with an arrow, that tells you there's a statistically significant trend. A mostly white box with an arrow means there's a trend, but it hasn't reached statistical significance. And then, as I mentioned, a lot of the indicators have target values. So you'll be able to see quickly which targets have been met with that green check and those that we still need to work on with the red X. And you may also see gauges that compare the Hawaii data to all US states or counties. Here is our Hawaii Health Matters homepage, and you'll see that our diabetes plan tracker is our featured content this month. And then the other announcements in this banner show the recent data releases and then also where you can register for the coffee break. So just a couple things on the homepage. There are additional resources on how to use the page. You'll notice we have this little mini dashboard here. So this is always related to our featured content, which is the Diabetes Plan 2030 tracker. So this gives you just a little sample of some of the data that's available in the tracker. And then below that, we have links to some features within the site and also to our sister site, hhdw.org. But we are mostly interested in the data trackers. So here again, if you hover over the data trackers, you can see all of these different trackers. And then if you hover over this, it will show you the 4 Healthy Hawaii Strategic Plan trackers. And that you can get a little overview about HHSP here. We're going to want to look at the diabetes tracker, but I also want to show you what happens when you just click on this. So now you'll see our additional trackers, and here at the bottom are our 4 HHSP trackers. So let's take a look at our diabetes tracker. All right, so here we have the landing page for the diabetes plan tracker. It gives a little information about why this is an important topic to monitor. You can see there's also a link to the plan itself and some information about who's been involved and how we hope this tracker will be used. Before I jump in, I do want to show that the site has a colorblind mode. So if you or anyone you're working with have visual disabilities, you can turn that on. And what it does is it adds these little thumbs up and thumbs down icons so that you can tell which way the indicators are going. The other thing I want to show you is this geography. So the default here is for Hawaii state, but the way the tracker is laid out, if you were interested, say, in just Hawaii County, you can choose that. And now all of the values in the tracker are filtered to show the value for Hawaii County. And it also adds a nice state value comparison. So just for those of you who might be interested in any of the 4 major counties, you can actually filter the whole tracker to that. I'm going to go back to the state. So here you can see the different sections. So we start with prevalence. There's diabetes-related outcomes, management, comorbidities. We've got our 2 risk factor sections and our social drivers of health. So it's organized to try to make it, oh, and you can use this little orange arrow to go all the way back up to the top. It's organized to try to make it easy to navigate so that users can find what they're particularly interested in. Let's take a look at one of these indicators. So we're going to look at a couple of them, but let's start with the diabetes death rate. So what you can see here, just in this landing page, is all the point estimate values for each indicator, in addition to these comparison values. So this is where you can get a little bit of context about what that value means. So this tracker itself gives you a lot of information just on one page. But if you are interested in looking deeper at any of these indicators, you can click on them. And this will open up a page with a lot more details. So here is the diabetes death rate. So for the state for 2023, it was 14.6 deaths per 100,000 population. And again, here are those comparison values. On this page, you can get a little additional information about each one by hovering over them. But we can say that our diabetes death rate in the state is lower than the US. It didn't change significantly from the prior value. It is worsening over time, and that trend has reached statistical significance, and it has not yet reached the diabetes plan target of 13.6. So below this, we'll see the definition. So this shows the age-adjusted death rate due to diabetes. For those of you who work with any mortality data, you'll know that the ICD-10 codes are how they code for cause of death. Again, a little bit of the public health importance of this indicator. And then we see our trend data. So here we can see there hasn't been a large amount of change. And I will show you how we can look at some of the subgroup data, but I'm going to use a different indicator for this one. I just kind of wanted to give you the overview. So below the trend, we see the map. So the default is for Hawaii state. So the map, it's just for the state. But if we wanted to, this bar here, which you may have noticed stays at the bottom, is where you can switch the location or the time period. And you can also select the target. So what I've done, I just selected Kauai County. So now we're looking at the value for Kauai County. And we can see, again, that's stable, it's worsening over time, and it does not meet the diabetes plan target. Now we'll see the trend data just for Kauai County. So this is a great resource if you're interested in a particular county. So, and then here's the map. So the map now color codes the different counties, ranks them based on value. So we can see here, Kauai County actually has the highest death rate due to diabetes, and then Maui, Honolulu, and Hawaii County. And these tables, you can download them as a CSV if you want to do your own data visualizations. So that is what the map looks like. And then I'm going to change it back to state for just to show you these different populations. So the nice thing, depending on the data source, so now we're looking at the state again. Here's our trend, our map, and then we get into this breakout data. So this is where you can see the data broken out by a variety of demographic characteristics. So here we're looking at it by age, race, ethnicity, and sex. And you'll see that the system actually does some basic statistics for you. So where you see a red bar, it means it's significantly worse than the state overall. And where you see a green bar, it means it's significantly better. And these charts, as well as the trend graph up here, have some options. So you can add, those confidence intervals are really small, but you can add the confidence intervals in the chart to show you exactly where those estimates range. Okay, let's look at a different indicator. Let's look at pregnant women with gestational diabetes. So this comes from one of our other data sources, our pregnancy risk assessment monitoring. And I do want to show you below the population data. So we'll look at all of this again. There are further resources. So here you can find related indicators, reports, fact sheets, plans, and these all come from our resource library. And then below that also is where you can find out information about the data source. So as I mentioned, this is the pregnancy risk assessment monitoring system. But let's just take a look. So again, we can see here some comparison values that give us an idea of what this means. I did want to show you, if you select the diabetes plan target, Now what you will see when you come down to the graphs, whether it's the trend graph or the population graph, you'll now see a line that corresponds to that target value. So you can see where we've been, how far we are from that goal. The other thing I wanted to show you with the trend graph is that now you can actually look at the different subpopulations over time. So here we can see the different age groups, and you can choose, say you were really only interested in looking at gestational diabetes among young mothers. Here you can see those values. So this is for less than 20, here's 20 to 24, and here's the state. So you can really do a lot with these graphs. And then again, we have our population data. So here we can see the age, birth weight, gestation, poverty level, race, ethnicity, and recipient of WIC benefits. And again, here you have the diabetes plan target, but if you wanted to turn that off, you can turn it off here, and then it'll just show you the state value. Okay, let's take a look at one more. We're going to look at one of those social drivers of health. So let's take a look at adults whose neighborhood supports physical activity. So we're going to click on this, and we will see our comparison values. You may have noticed already that this has a PAN plan target, our physical activity and nutrition plan. This is also one of our Healthy Hawaii strategic plan trackers. So being consistent among the groups, that we are keeping the target value at 74.4%. Here we can see for Hawaii, 66.1% of adults reported that their neighborhood supports physical activity. And this is a good example of when that definition comes in handy. So this will actually show you the question wording. So they were asked, does your neighborhood have sidewalks, bike lanes, multi-use paths, or trails for walking or cycling? That's a case where the definition is very helpful to understand what the measure is actually showing. Here again, we have our trend data. And for example, maybe we want to look at race, ethnicity. This is a really busy graph. So let's just look at Filipino, Japanese, Native Hawaiian, and white. And we can see here the different trends for each of those races, ethnicities. And then again, also you can show the confidence intervals for this graph. Here again is our map. I do want to show you again what the data looks like broken out by county. Let's take a look at the differences across the different counties. So here we can see there's quite a bit of difference. So in Hawaii County, where it's a bit more rural, there's a lower percentage of adults who report that their neighborhood supports physical activity. And then Honolulu County is actually the highest. One other thing I wanted to show you up here, when you're looking at smaller geographies, you can also put the state trend value on there so you can compare. Okay, before we jump to the activity, I did just want to show you our resources and tools. I mentioned all of those additional resources come from our resource library. If you wanted to just see what we have available, you can do a keyword search and you can see some of the different things. So this is a plan, this is a report. There's also different data sites and things like that. So just to show you what is available in our resource library. Okay, so here is an opportunity for you to do a little hands-on work. Take a few minutes and explore the Diabetes Plan 2030 tracker in Hawaii Health Matters and answer these questions. I will go ahead and go over the answers to these activities. So the first question asks, what was the rate of adults with prediabetes for the state? And which county had the lowest rates? So we're going to go back to our diabetes tracker. We're interested in adults with prediabetes. So the rate for the state is 17.0%. And then it was asking secondarily, which county had the lowest rate. So we're going to look at the data by county, and we will see that Hawaii County has the lowest rate of adults with prediabetes. Okay, the next question asked, which of the comorbidity indicators are trending up, and are any of them significant trends? So we're gonna scroll down to our comorbidity section, and we can see that this one is trending up, not significantly. This one's also trending up. So is this one. And then we have a couple trending down and one more trending up and one more down. So none of these are significant, but the number that are trending up is 4. Okay, and then the last question asks about teens who drink soda or sweetened drinks at least once per day. So this is going to be in our youth risk factor. We're looking at teens who drink soda or sweetened drinks at least once per day. The question asks for the state prevalence, so which is 31.1%. And then it's asking if there's a difference by sex. So we will scroll down to our populations. And we can see here that although males do have a higher rate than females, if we look at those confidence intervals, we'll see that they overlap. So we can't say that there's a statistically significant difference by sex. Okay, let me put those answers up. And I do want to invite you to join our next coffee break. So in May, we are going to be looking at maps and geographies in both HHDW and Hawaii Health Matters. So if you're interested in looking at data by different geographies, join us next month. If you have any questions, please contact us at profiles@hhdw.org. So thank you again for joining. We hope to see you in May when we'll be looking at maps and geographies in our 2 websites. Mahalo and enjoy your day.